Hi everyone, I'm Dr. Diab, and in today's episode of Just What the Doctor Ordered, I will be talking to you about cataract surgery. In a previous episode, I've described what a cataract is, a clouding of the natural lens of the eye that affects the vision. And today we'll be talking about how that's managed. So cataract surgery is an outpatient procedure. Some physicians do it in a small surgery center or surgical suite that's attached to their office. And other physicians like myself do it in an outpatient surgery center that may be a standalone building or may be part of a hospital. In the case of the way I do surgery, I have an anesthesia team that works along with me. So we'll either have an anesthesiologist or a nurse anesthetist in the room with us. And they will be giving you an IV and some medication in there to relax you so that during the surgery, you'll be in what we call twilight sleep. Some people are more awake than others. Some people actually fall completely asleep. And we adjust the amount of anesthetic given based on how comfortable you are. So our goal is for everybody to be comfortable. It really doesn't matter to me whether you're asleep or awake as long as you're feeling good. Prior to surgery, you come into the surgery center and you get checked in. You change usually into a hospital gown. And then the nurses in the preoperative area will give you a bunch of drops that I've ordered. Usually those drops will be mostly to dilate the pupil, and also we give some antibiotic drops as well to reduce the risk of infection at that time. Then you'll be laying sitting in a chair or laying in a bed, and we'll wheel you back into the surgical suite, and gradually we'll kind of get you laying down flat and get you comfortable, and the anesthesia person will put their monitors on, such as heart monitors and a pulse oximeter on your finger. They'll give you some oxygen through a nasal cannula and things like that. So once we get you settled, I'll usually put a solution in, a betadine solution into the eye to clean the eye. Then we cover your face and part of your body with a sterile surgical drape. After we've put drops in to make sure your eye is numb, I start the surgery by making a small incision on the eye. It's just about 2.4 millimeters, and I enter your eye and I open the capsule that surrounds the natural lens of your eye, and from there I remove the lens by breaking it into small pieces and sucking it out of the eye. So once we've removed that, then we take the intraocular lens, which is the lens implant, you fold it up, or it comes pre-folded in a very small shape so that it can fit through the very tiny incision. And then we put it into the remaining capsule that came from your previous lens, and we unfold it in the eye and position it and center it. Most of the time we close the incision without any stitches. Occasionally we will use a stitch if needed. It's usually approximately a 10 to 30 minute procedure depending on the preparation that we do before and whatever needs to be done during or after the surgery. And usually people can right away see out of the eye. I generally just cover the eye with a plastic patch that's clear so you can look right through it. So that kind of gives you a general idea of what to expect on the day of surgery. A lot of people are nervous, and that's very normal when it comes to the eye, but we generally focus a lot on keeping you comfortable and make sure that you're relaxed during the procedure. And then most people look forward to going out to lunch afterwards with whoever family member or friend who's come with them that day. And I usually see people in the office the following day. As always, nothing that I've said today should be construed as medical advice. If you do have specific questions about cataract surgery, please do see an ophthalmologist and ask them. In a future episode, I'd like to talk more about the type of lens implants that we can put in the eye and how we select them and the input that you need to give into that process. Thank you.